Hello everyone, I'm Nick.
And I'm Sarah. Welcome to HSN's new web series, MythFracture.
The show where we take hospital and healthcare myths and put them to the test.
Today's myth is about wait times. We all know that when you come to the emergency department, there's some waiting involved.
But when people say, I don't want to wait around for 10 hours to see a doctor, are they actually going to wait for 10 hours? Let's go check it out.
This is Chris. He's going to help us test this myth today.
I'm happy to help.
So, can you tell us a little bit about what brought you into the emergency department today?
Yes, absolutely. So what happened was that I was at home, I tripped, and I twisted my ankle. So it really hurts when I put pressure on it, so I'm starting to think that it might actually be broken.
Oh, do you think you'll be okay?
I hope so. It hurts when I put pressure, but we'll see. So I'm here.
All right, best of luck, and I guess we'll see you again in a few hours?
Yes, absolutely.
While Chris is being admitted, let's go over some things. First thing, the term wait time. It's a bit misleading. It's a term that has been used for years, but it's also one that is misunderstood. Regardless of what alternative we come up with, the public always uses wait time when they talk about their time in the emerge department. Here at HSN, what the community calls wait times, we call treatment time.
And that's the most important thing to remember when we're talking about this myth. When the headline says HSN reduces wait times, what they're actually saying is HSN reduces treatment times. Okay, now that we're all on the same page, I'd like to introduce you Dr. Rob Lepage. He's a physician and also the medical director at HSN's emergency department.
So I'm going to try to explain today what we mean by wait times, or what we like to call treatment times. When you hear that from somebody that they waited 6 hours in the emergency department, that doesn't mean that they waited 6 hours to see a nurse or a physician. The wait time, as defined by the Ministry of Health, is the total time that you spend in the emergency department from the time you first entered the door and were triaged until the time you actually left the emergency department to go home, or that you went up to a ward if you were admitted to the hospital. So the first step, so Chris, who has injured his ankle, shows up in the emergency department, is triaged by a triage nurse, who then will assign him what's called a CTAS level. So that's the Canadian Triage and Acuity Scale. And the CTAS ranges from 1 to 5. A patient who's assigned a CTAS 1 is critically ill. It's a patient who's in a coma, has a cardiac arrest, is having a great difficulty breathing, or is in respiratory failure, or they've been in a very serious car accident. So those patients are seen immediately by a team of nurses and doctors. Somebody who's on the other end of the spectrum, a CTAS 5, is maybe coming in for a prescription renewal. Now, another point that I think is important is that the Ministry of Health has set up guidelines for all emergency departments in Ontario that patients who have a CTAS 1, 2, or 3, from the time they get triaged and then either discharged home or discharged up to an inpatient bed, that whole period of time should take 8 hours or less. Now, for patients who have a CTAS 4 or 5, so the lower acuity patients, that whole process should take 4 hours or less. So, hope that helps explain what wait times are.
So in this case, Chris is a CTAS 4. This means that while he's in emerge, he'll be triaged and assigned his CTAS score. He'll be registered and brought to a lower acuity waiting room. He'll be seen by a physician and be sent for tests, in this case, an x-ray. He'll revisit the doctor to explain the results of the test, have his ankle put into a cast, and then discuss treatment plans, and he'll be discharged with the proper knowledge for the care of his injury. Hey Chris, I see that you're out. How did it go?
You know what, truth be told, it went pretty well. As I thought, I did have a broken ankle, so I'm going to be rocking these crutches for the next little while, and I got a pretty cool cast out of it too.
Oh, okay. Looks like you're going to have to be careful for next time.
Yes, I'm going to be a little bit careful in the future, for sure.
Absolutely. So how long do you think you were in there for?
It was pretty busy tonight, so I was probably in there for about 3 hours. It was worth it in the end though, the bit of a wait.
Speaking of wait, how long do you think that you actually waited to receive your care?
Between seeing the doctor, getting an x-ray, and then having the doctor see my x-ray, I was probably in there for about 2 hours waiting.
Okay, and if somebody asked you how long you were in there for, you'd say maybe 3 hours?
My waiting time was 3 hours.
All right.
Yeah.
Thanks so much for your help, Chris. It really helped us debunk this myth today.
My pleasure.
There you have it, ladies and gents. Treatment time. It isn't just a term that hospitals use to scare people, and it actually means what has been labeled. Wait times. In turn, when you hear that the hospital's wait time is 5 hours, that doesn't mean that you're going to be sitting around waiting for 5 hours. It means that it was 5 hours from the time you walked into the emerge department to the time you left. So in closing, when you see wait time, don't think the obvious. Think about your total treatment time.
Thanks for tuning in to MythFracture. I'm Sarah, this is Nick, and we'll see you all next time when we take on another hospital myth.
Next month on MythFractures, vaccinations. Are they much more than a pain in the butt?